This week on the BackTable podcast.
A few years later, I found another tumor. So I called Dr. Georgiades and he said, come on up, we'll fix it. And he said, you just need to check yourself every year with an MRI. And then a few years later, I found a third one, this time in the right kidney instead of the left. He said, Clint, why don't you just fly back up to Baltimore and we'll take care of that one too? And he did.
Do you have a punch card at this point?
No,
the fourth cryoablation's free.
Well, I'd just as soon pass on that, Eric.
Yeah.
But the procedures themselves have been remarkably effective. I'm still sailing, still hiking in the mountains, and at age 71, I'm happy about that.
Hello, everyone, and welcome to the BackTable podcast, your source for all things interventional and endovascular. You can find all previous episodes of our podcast on iTunes, Spotify, and backtable.com. I'm your host, Eric Keller, an interventional radiologist in southeastern North Carolina and a board member of the Interventional Initiative, which is a nonprofit devoted to raising awareness of and access to minimally invasive image-guided procedures. So today, rather than chatting with someone about performing one of those procedures, we're actually going to talk to someone who had one of those procedures about their experience. And the idea of that is to try and raise awareness amongst the general public about these life-changing options. So today we have Clinton Lanier here, who has actually undergone multiple cryoablations for kidney cancer. And he was kind enough to share his experience with us and talk a bit about how he came to know about cryoablation and what it was like. So I really appreciate you coming on the podcast with us, Clint.
Well, Eric, thank you very much for having me. I think I have a good story to tell, and I'd be happy to share it.
Well, let's just dive right into it. Where do you want to start? Do you want to kind of start from the beginning, like the initial diagnosis, what was kind of going on in your life, how you found out about it?
Yes, that would be great. Well, I had decided to suspend my practice for a while. I'm an attorney. Decided to suspend my practice and go sailing with the family. And sold the house, suspended the practice, bought a boat, and sailed to the Bahamas and spent a few years. And the reason I did that was because my senior partner had passed away of cancer. And I thought, well, maybe I'd better start enjoying life with the wife and kids. And during the middle of this 6-year cruise, I was diagnosed with an incidental finding of a small tumor in my left kidney. And I knew that that was not a good finding and did my research and consulted with many physicians, and what I was hearing from nearly everyone I consulted with was, well, you're going to lose the kidney or lose half of your kidney. No one ever mentioned cryoablation, but this was back in 2009, and it just wasn't that prevalent. But I was researching the internet one night and found a little article by Dr. Christos Georgiades and Ron Rodriguez saying cryoablation cures early kidney cancer. I thought, well, this has got to be a hoax. I've never heard of this.
Just prowling along online, and there's a magic pill for that, or whatever else, right? So
I thought this was clickbait, but I clicked on the article, and it said, well, it's from Johns Hopkins. I said, well, that's a rather reputable institution. And I read the article, and it was talking about an outpatient procedure. Outpatient. No 12-inch scar, no risk of mortality to speak of. And I said, well, I'm going to give a call to Dr. Georgiades. So I called his office, and darn if he didn't call me back the next day. I sent the films up. He said, we can take care of that. I flew to Baltimore. He took care of it, and I went back to sailing.
Wow.
So I was very happy with the procedure. It was remarkably easy from the patient's standpoint to have this procedure and go home the same day.
And you get to keep your kidneys.
I did, and afterwards I had normal kidney function. And then a few years later, I found another tumor. So I called Dr. Georgiades and he said, come on up, we'll fix it. And he said, you just need to check yourself every year with an MRI. And then a few years later, I found a third one, this time in the right kidney instead of the left. He said, Clint, why don't you just fly back up to Baltimore and we'll take care of that one too? And he did.
Do you have a punch card at this point?
No,
the fourth cryoablation's free.
Well, I'd just as soon pass on that, Eric.
Yeah.
But the procedures themselves have been remarkably effective, and I'm still sailing, still hiking in the mountains, and at age 71, I'm happy about that.
That's incredible. Maybe let's go through it a little more. And that, so was the consultation over the phone then? You sent him up the films, he kind of talked to you over the phone, and then you showed up the day of the procedures when you first met him in person, or did you have to kind of go up there beforehand a time or something like that?
Well, we're calling back to 2009 when it was still labeled as experimental therapy back then. But recalling, as best as I can recall, I sent him the films, and he gave me a call and told me to show up, and I did, and it was that easy.
And what was the procedure like then? Were you, to take us through that, I guess, what was that day like? What was the recovery like?
Well, not having been through anything like that before, I was a bit nervous, but I had spoken with Dr. Georgiades and Dr. Rodriguez, and they explained, well, we'll just image your kidney in the MRI machine, or in the CT, and we will stick in 1 or 2 probes, we will freeze it, and you will go home, and you'll likely feel little or nothing. And that's exactly how it occurred. I was placed in the CT, they imaged the kidney, found the tumor, stuck in the cryo devices, I'm not sure what they're called, but they worked, froze the tumor, and I went home the same day.
Well, no real pain afterwards or things like that, I guess.
None whatsoever.
Wow.
Now, during the procedure itself, there are 2 freezes. The first one was, I couldn't even tell it was happening. The second one got my attention, but nothing to deter me, nothing to tell them to stop. It was a little uncomfortable, but compared to a nephrectomy or a partial nephrectomy, the cryoablation is just a walk in the park. And it works.
I take it the other 2 then were similar experience. You went up there and really kind of no recovery afterwards. It sounds, it's just like you showed up, you were out that same day.
Yes, and I personally, I find that remarkable. Now, I know that eventually, if I have enough of these tumors, maybe it will affect my kidney function, or maybe one will occur in an area that's not conducive to cryoablation, but my fingers are crossed because I've got the routine down now. I know how to find Dr. Georgiades, and if necessary, I'll come for a 4th ablation. But the fact that these ablations are available, that's wonderful. And it was strange to me that most of the physicians I spoke with in 2009 did not know about the procedure, or alternatively did not tell me about it. And I found out by my own research. Now is a different story. Now cryoablation is no longer experimental, and I think it's one of the gold standard treatments for small renal cell carcinomas. That's what I believe.
It's definitely much more common, but I will say that kind of a theme from these podcast episodes so far is kind of people having to advocate for themselves. We kind of had this common theme of, well, no one told me about it, and then I went online, or I was talking to a friend or something like that, and they brought up this other option. I just think sometimes medicine gets in these silos and people aren't as familiar with outside the box or things like that, but it's so much of a team sport that it's important to have those other options. But you're right, now it's much more common, and I think much more accepted. Like I get consults for that procedure all the time now without having to kind of go fishing for them or reminding people about it. So
I know back in 2009, when the procedure was still experimental, I called up Blue Cross and they said, well, we're not going to cover that. I said, well, that's upsetting. And they said, now we will pay for a partial nephrectomy, which will cost probably $200,000, but we will not pay for the cryoablation, which would cost $8,500. I said, wait, let me get this right. You're willing to pay over a couple $100,000 to take care of me, but you won't pay for the $8,500 procedure. They said, that's right. I said, that doesn't make a bit of sense. So I had a couple of chats with their legal counsel, and then they approved the procedure.
Oh, that's the advantage of you being an attorney, I guess, huh?
Well, it worked that time.
Yeah.
And I was very, very glad. I like these success statistics with this procedure. And being minimally invasive, well, from a layman's standpoint, a non-medical person, it does border upon magic that this can be done.
It's interesting a lot of times when I talk to people about this or kind of these other minimally invasive things, they're always thinking that it's going to be this big surgery or incision. And I think it's really surprising to people. It does sound like magic, this idea of there's no incision, no stitches, nothing like that. It's just a Band-Aid at the end. So they're just putting this wand or probe or whatever you want to call it in there, and the end of it just turns that tumor to ice and kills it.
Yes, the only restrictions I had is Dr. Giorgiotti said, well, why don't you take it easy on surfing for a while? Don't lift a lot of weights for a few days. And those were easy restrictions to follow. No problem at all.
Do you think there's anything that they did that made the experience smoother or better that you can think of in terms of before and afterwards or anything like that? I just think it's always important for us to hear, for clinicians that do this, of things to make the experience better for people.
Well, what made it better for me is to realize that the procedure existed. It really was, from the patient's standpoint, a walk in the park. It wasn't the big operation that I was so fearful of. It wasn't the large scar or the warm ischemic time, that would jeopardize the entire kidney. Very few operative complications with the procedure. So by the time I was ready to slide into the CT machine, I was comfortable with the procedure and quite at ease. And that meant a lot to me. It really did.
Yeah. No, I mean, I think it's a great option. It sounds like that kind of being empowered with that information put you at ease, and then it sounds like they didn't disappoint up there at Johns Hopkins, eh? So
no disappointments at all. One of these days I'd like to go up there just as a tourist instead of a patient. They do have a nice harbor to anchor in there, and we did anchor there once. So that was a treat.
Not for a cryoablation though. Or was that you anchored there for a cryoablation? No, just joking. But
I just wish that there was a way to inform the people that are in my shoes, to let everybody know about cryoablation, because it's not, from what I have learned from speaking with my friends that are also kidney cancer patients, many of them were not informed as to the procedure either. And one of my friends had a partial nephrectomy for a 2-centimeter tumor. And I said, well, gosh, I'm sorry you're laid up. What about cryoablation? And he said, what's that? And this was just about 5 years ago. So I'd like to assist in spreading the word that the procedure is available for select patients. I know that everybody won't fit the treatment parameters, and not everybody will qualify. But for those that do, I would hope that they would at least be told about the procedure.
It's nice to know your options, even if it's not the right thing for you. And that was a big inspiration for doing this, was just another way to kind of get the word out there that maybe if someone like yourself is Googling things, recently got diagnosed with renal cell carcinoma or something like that, and actually you do ablations for other things too, like liver cancers and lung cancers too. It's the same principle, that maybe they'll come across this and hear from someone like you that maybe it's an option worth bringing up or looking into. So hopefully this is a little part of spreading the word to people, but there's definitely more to do.
Well, I know that if I Google cryoablation and kidney cancer in the present day, as compared to 2009, I'll get 30 or 40 articles immediately advising me how wonderful it is as an option. But back in 2009, that was different. There was only one article, and I had to stumble upon it, and I'm glad I did. But today, if the patient will perform a bit of research, at least the patient will perhaps ask his physician, what about this option? And hopefully it will be a viable option for that patient. Made a world of difference for me. I'm very happy with it.
Times 3.
Yes.
So, well, do you have any other, advice for either people that do these procedures or people thinking about undergoing it, kind of as we're we're wrapping up.
I want to be a good advocate for this. Two of my friends have died of kidney cancer.
Oh, really? Wow.
They were not fortunate enough to have an early diagnosis, and traditional therapy just didn't work for them. But being such a prevalent cancer, I just want to help spread the word about cryoablation, because I am a happy patient. I have no problems. Usually you get diagnosed with metachronous kidney cancer. You read on the internet, and it's called an unbeatable leviathan in the old articles, and it's a little concerning when you realize what you have has been called an unbeatable leviathan. So this is not a good thing. But with cryotherapy, it is not beatable, but it is manageable. And I asked Christos, I said, is this going to get me? Is this going to do me in? He said, Clinton, it will never do you in as long as you get your yearly scans. And from a patient comfort standpoint, it just lets me sleep at night. Yeah. Knowing that there is a therapy that can deal with recurrent tumors. Attorneys sometimes fall into a trap of not thinking outside the box. If there's a way that a particular case has been handled in the past, well, I'm going to continue to handle it that way, even though other options might be available and better for the client. And I don't know if physicians think that way or not. If I were a kidney surgeon, I would think, I would hope that I would not be of the mind that, well, I've done nephrectomies for 30 years. I'm just going to keep doing them, and to heck with this cryoablation stuff. I don't know if that type of thought pattern occurs in the medical community. It does in the legal community.
It definitely does. Actually, that was my master's thesis, where I studied the cultures of different specialties and what kind of underpins turf wars when physicians kind of compete about the right thing to do. And it's a lot of that you trust what you know. You trust yourself. And so if I'm a kidney surgeon and I'm good at what I do and I'm really good at partial nephrectomies, when something new comes along, it's going to take me a long time to adopt it because I'm not the one doing it. I'm going to trust myself and what I've been doing over that. And that happens a lot in healthcare, where it takes a lot to kind of move people and convince them, particularly if it's something that themselves are not doing, like it's outside of their specialty. It seems particularly hard for people. And that's a lot of what I think my specialty struggles with, is that we are very much dependent on other physicians for sending us cases, but we also tend to create these new ways of doing things that people haven't heard of before. So it's an extra struggle to get those things out there. So, cryoablation's been around a long time, but it takes a long time to get any buy-in about it.
Well, I would think that if now some patients will not do independent research, and they will, the initial doctor will say, well, you need a nephrectomy, and they will say, okay, and just go with it. But if the patient does any research and finds out about cryoablation or the other interventional therapies, I would bet you that patient is going to give a ring to the doctor's office and say, well, how about this? And I said, well, I don't do that, but I can refer you to Dr. Keller, who can do it. So hopefully that will happen more and more. At least in an ideal world, I think that would be great.
I think it definitely does. I just think it takes, you got to be open-minded and comfortable enough with yourself to say, oh, this is something that I don't do, but is a reasonable option. And, it's a shared decision with your patient. So referring it to someone else, and it's no harm off you. It doesn't make you less of a healer or a good surgeon or whatever else, right? It's just some things are going to be better for one patient or better for another patient. And really, it's that multidisciplinary team sport that I think makes the best type of healthcare.
I sure do appreciate what you do and all the help that the medical community has provided to me, because I like walking the trails and I like surfing and I like sailing, and I hope to do it for a few more years.
Well, I hope so for you too. Well, I really appreciate you coming on the show and sharing your experience. I think it's just invaluable to hear it, straight from the horse's mouth, so to speak, that you've actually undergone this 3 times to be able to talk about what a relatively easy option it is if you qualify for that procedure as an option for treating kidney cancer. So I hope that we'll get to hear from more people as well. I hope for our listeners that you enjoyed tuning in. I hope to to see you next time and that you'll join us for hearing about another person's experience with these amazing life-changing options.
Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend. If you have any questions or comments, direct message us at @_BackTable on Instagram, Twitter, or LinkedIn. BackTable is produced and hosted by myself, Aaron Fritz, and co-hosts
Chris Beck,
Sabine Dawn,
Michael Barraza,
and Ali Behetti.
Our audio team is led by Kieran Gannon, with support from
Aaron Bowles, Josh McWhirter,
and Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Ann Dang,
Manisha Naganathanahali,
and Manbir Singh Sandhu.
Administrative support provided by Judy Dela Cruz.
Thanks again for listening.